Protecting lungs with healthy habits and respiratory disease prevention methods according to WHO standards. Hello friends. Breath is the source of life, but small changes related to respiration are very easily overlooked. If these manifestations are not correctly recognized and monitored in time, they can progress into dangerous chronic lung diseases, affecting long-term health and quality of life. Conversely, when detected early, many lung problems can be completely controlled, helping to maintain stable respiratory capacity and limiting serious complications later on. In this video, we will together with you analyze common early signs of lung disease from a scientific perspective, based on current medical guidelines from the World Health Organization and international medical standards. The end of the video will note the most important information you should not ignore. You will understand why seemingly very small changes in respiration carry important meaning and when a respiratory symptom needs to be considered a serious warning. Before going into the detailed content, please subscribe and turn on notifications for the MMM channel with the YouTube handle @MMM YouTube1 to continue accompanying us in the healthcare and disease prevention video series throughout the human life cycle. And now we begin the main content. To deeply understand protecting the respiratory system according to the strict standards of the World Health Organization and United States medicine, we need to perceive the lungs as a sophisticated system facing enormous pressures. The latest reports in 2025 indicate that respiratory diseases still rank among the leading causes of death, but the majority of them can be prevented if we have correct knowledge. One is completely quitting smoking, and building a smoke-free living environment is the most core foundation. According to updated statistics from the World Health Organization, tobacco causes more than 8 million deaths each year, including about 1.3 million cases of non-smokers exposed to secondhand smoke. Tobacco smoke contains more than 7,000 chemicals, with at least 69 substances confirmed to cause cancer, directly impacting and paralyzing the ciliary system that functions to clean the respiratory tract. When you stop smoking, after only 20 minutes, your heart rate and blood pressure will begin to drop. And after 12 hours, the carbon monoxide concentration in the blood will return to normal. In the United States, 2025 studies affirm that those who quit smoking before age 40 can reduce the risk of death from tobacco-related diseases by up to 90%. Establishing strict rules for a smoke-free living space is not only protecting yourself, but also protecting the fragile lung structure of children, who have a faster breathing rate and absorb toxins more easily than adults. 2 is controlling air quality in daily living spaces to minimize chronic respiratory irritants. The 2025 Global Air Quality Report shows that 99% of the world's population is breathing air that exceeds the World Health Organization guideline limits. Fine dust pollution with a size below 2.5 micrometers is a silent enemy, as they have the ability to penetrate the protective barrier of the lungs to go straight into the blood. You should regularly open windows to create natural air circulation and simultaneously use standard air filtration devices capable of filtering ultrafine particles. Besides, limiting the use of coal stoves, wood stoves, or scented candles and room sprays with strong artificial fragrances will help reduce the burden on the respiratory mucosa. Monitoring the daily air quality index and proactively wearing specialized masks when moving in crowded urban areas is a mandatory habit to preserve lung function. We must realize that every breath in a polluted environment is a time the lungs must work overwork to filter toxins. And over time, the lungs' self-healing ability will be eroded if not protected in time. 3 is building a specialized nutritional regime to strengthen resistance for the respiratory system is a root cause prevention method. Modern medical studies in the United States in 2025 emphasize the role of a plant-rich diet in protecting lung function. Foods rich in antioxidants like vitamin C found in oranges and tangerines, or vitamin E in nuts, help neutralize free radicals arising from the process of breathing polluted air. Especially, maintaining adequate water supplementation every day helps keep the protective mucus layer in the respiratory tract at the necessary moisture level, supporting the process of transporting and expelling bacteria outward through natural reflexes. A dehydrated body will cause the mucus layer to become thick and sticky, causing difficulty in cleaning the lungs and easily leading to infection. Experts recommend that we should minimize processed foods containing a lot of salt, because high salt concentrations in the blood can increase respiratory inflammation and cause water retention in lung tissue. Consider food as a precious medicinal source to nourish healthy lungs from within through every daily meal. 4 is maintaining regular physical activity with appropriate intensity to improve vital capacity and endurance for respiratory muscles. When you perform exercises such as brisk walking, swimming, or cycling, the body requires a larger amount of oxygen, forcing the lungs to expand maximally to meet metabolic needs. This process not only firms up the intercostal muscles, but also helps improve gas exchange efficiency at the alveoli. The World Health Organization recommends that every adult should exercise at least 150 minutes per week. According to 2025 data, people who maintain regular exercise habits have 15% higher lung capacity than sedentary people, helping them have a better ability to withstand respiratory infectious diseases. However, you need to be careful to avoid practicing at times when the air is heavily polluted or in places near traffic routes with high exhaust density. Persistent training is the best way to keep the lungs always supple and flexible. 5 is strictly implementing epidemic prevention hygiene measures and full vaccination to create a solid protective barrier. Regularly washing hands with soap is a simple but extremely effective action in preventing disease agents transmitted through the respiratory tract. The World Health Organization affirms that vaccines are one of the medical achievements that help save millions of lives each year from severe pneumonia. You should follow the annual flu vaccination schedule and receive the pneumococcal vaccine according to a doctor's instructions, especially for people over 65 years old or those with underlying medical conditions. Respiratory infection episodes, if not prevented, will leave permanent fibrous scars, reducing the body's oxygen exchange capacity. By proactively vaccinating, we not only protect ourselves, but also reduce pressure on the community health system. Prevention always brings much higher economic and health efficiency than treating lung injuries that have already formed. 6 is practicing deep breathing techniques, especially the diaphragmatic breathing method, to optimize the body's oxygen absorption capacity. The current common habit of shallow chest breathing inadvertently causes a large portion of lung capacity at the bottom to go unused, leading to the accumulation of residual gas. You should focus on inhaling deeply through the nose so that the abdomen expands and exhaling slowly through the mouth. This technique helps increase pressure in the air sacs, helping them expand fully and improving blood circulation. Clinical studies in the United States in 2025 show that practicing correct breathing helps reduce stress hormone levels in the blood and improves oxygen saturation levels up to 3% after only 10 minutes of practice. Spending a short amount of time each day to practice abdominal breathing will help you feel more alert and minimize shortness of breath when working at high intensity. This is a natural but extremely powerful method to improve quality of life and protect the respiratory system. 7 is focusing on periodic respiratory health screening and examination to detect abnormal signs early. The lung is an organ with very good compensatory ability, meaning even when function has partially declined, you may not yet feel clear symptoms. Performing respiratory function tests or lung imaging as medically indicated helps doctors accurately assess lung elasticity and ventilation capacity. According to the latest guidelines, people living in polluted environments or working in factories need lung screening at least once per year. Early detection of diseases such as lung cancer or chronic obstructive pulmonary disease in the early stages can increase the successful treatment rate to more than 80%. Do not wait until breathing becomes difficult to seek medical care. Consider lung protection a long-term investment for the future. 8 is understanding and reacting promptly to warning signals from the body before the illness turns serious. A cough lasting over 3 weeks for unknown reasons, a feeling of chest heaviness when breathing deeply, or frequently being short of breath when climbing stairs are signs that are not allowed to be ignored. We recommend that you absolutely should not voluntarily use cough-suppressing medications without a physical examination by a medical expert. Medication abuse can hide symptoms of dangerous diseases such as tuberculosis or early tumors. Understanding and alertness in listening to the body is the decisive factor helping you avoid unfortunate complications. Consider each abnormal sign as a reminder for us to take more thoughtful care of our lungs. 9 is managing stress and ensuring quality sleep to maintain balance for the body's natural immune system. When the body is tired, the defense capacity of the respiratory mucosa will weaken, creating conditions for bacteria to invade. A deep sleep helps the body recover cells and regulate a stable breathing rate. 2025 medical data indicates that people who sleep under 6 hours per night have a 3 times higher risk of respiratory infections than those who get enough sleep. You should create for yourself a quiet, cool sleeping space and avoid using electronic devices before sleep so that the lungs and nervous system can rest fully. Caring for mental health is the indirect key to helping protect the respiratory system from the negative impacts of modern lifestyles. 10 is raising community awareness and sharing knowledge about lung protection to create a healthy living environment for everyone. Our health is linked to the common atmosphere that the whole community is breathing. When you share this video or spread good habits, you are contributing to reducing the disease burden for society. The World Health Organization always emphasizes that community education is the most sustainable solution in preventing non-communicable diseases. Each of our small actions, from planting more trees to reducing the use of plastic bags, contributes directly to improving air quality. Let's act together today for a green future and healthy lungs for ourselves and future generations. Finally, we need to emphasize that lung health does not decline in one day, but is affected gradually over time. Each long cough that is ignored, each slight shortness of breath that is disdained, and each delay in health checkups all contribute to increasing the risk of long-term respiratory damage. International health organizations all affirm that early recognition of abnormal lung signs is the most important foundation for protecting respiratory capacity and quality of life. When humans correctly understand the signals the body sends out and act promptly, the burden of lung disease can be completely minimized. Proactively monitoring respiratory health not only helps prevent disease progression, but also contributes to maintaining a more active and sustainable life. If you find this content useful for yourself and your family, please subscribe and turn on notifications for the MMM channel with the handle at MMM YouTube and the LQT channel with the handle at LQT YouTube. On these two channels, we will continue to share in-depth content on protecting the lungs, liver, kidneys, cardiovascular system, and common non-communicable diseases. Health does not come from luck, but is the result of correct understanding and choices made at the right time, in the right way. Thank you for following this entire video content.